Routine mammograms and the age women should start getting them. It's first tonight at 10. Good evening, I'm Eric Franke. New guidelines from a federal task force now recommend against routine mammograms for women in their 40s. It is a sudden and drastic shift from years of science. The Night Team's David Douglas has the story. David.
What's troubling to many, Eric, is the findings seem to contradict themselves, cautioning against early routine screenings because they create anxiety and false positives, while accepting the practice reduces breast cancer mortality.
This woman's lucky because it's not in her dense breast tissue.
Her career dedicated to breast imaging, Dr. Gail Sisney knows mammograms save lives.
Only in 1990 did the deaths start dropping. And we believe that the death rate started dropping because of mammography.
As chief breast cancer radiologist for the Carbone Cancer Center, she strongly disagrees with the new federal guidelines and questions the methods used to develop them.
This announcement was really disappointing. I don't see any new data that brings us to new conclusions. This is simply reworking old data with assumptions that I think are kind of flawed.
With no known cure, the Wisconsin Women's Health Foundation shares the frustration, saying early detection is a must.
So to tell people that they have to wait until age 50 because there's too many false positives and there's anxiety caused by it, and they say that the anxiety is worse than waiting until you're age 50, it just doesn't make sense.
I would question, is this about saving women's lives or is this about cost? And is cost political or not in the year 2009?
And consider this statement from the American College of Radiology, quote, "The recommendations make unconscionable decisions about the value of human life," adding, "The task force made its recommendations without allowing for public input or involving anyone with expertise in breast cancer detection and diagnosis."
We know that if women do not have screening mammography, especially beginning at age 40 and optimally annually, that there will be more cancer deaths from breast cancer.
Dr. Sisney says she would understand if there were a new tool to screen for breast cancer, but since there isn't, this takes away the only one we know works. It should be noted this has happened before. In the early 90s, the National Cancer Institute stepped away from recommendations to screen younger women, later saying they were wrong and bad studies produced the data.
You can certainly see why people would be concerned about this. Now, insurance coverage, how might this affect that? You know, insurance policies and coverage.
It is too early to tell at this point, but that is certainly the fear that the recommendations could be used to limit what is paid for.
The Night Team's David Douglas reporting. David, thank you.